Hello, everyone. Good afternoon, good morning, good evening from wherever you might be connecting with us. I want to welcome you to the 19th episode of Insight Webinar. This is a public health webinar series hosted by eHealth Africa. And this webinar series enables us to have insightful conversations, with public health professionals on issues and pathways for improved public healthcare delivery. My name is Tijesu Ojumo, and I'm a communications coordinator with eHealth Africa. I will be your moderator for today's Insight webinar conversation. Now, to take you even further, out of the estimated 7 billion people on Earth, about 1 billion people are served by healthcare facilities with unreliable electricity supply. Or even in some cases, it's not just unreliable, there's just a total absence of electricity access. And this is according to a report by the World Health Organization. Now, this worrisome statistic is no doubt has a significant impact on public health delivery, especially in primary healthcare facilities. The poor access to power supply in public health care centers affects quite a number of things, including vaccine potency, blood bank storage, operation of medical equipment, and adequate lighting for essential procedures. And as energy demands in the healthcare sector continues to increase, there is a continuous reliance on backup electricity systems like generating sets in healthcare facilities. Please, if you are here, can you please mute your mic? Thank you very much. Like I was saying, at the moment, the healthcare sector contributes to at least 5% of global carbon dioxide emissions. And in this vein, this 19th episode of Insight Webinar will be discussing integrating renewable energy solutions for primary healthcare facilities. I'll take that again. Today, we are discussing integrating renewable energy solutions for primary healthcare facilities. So right now, I'd like to welcome our Deputy Director of Programs, Dr. David Akpan, to give a warm welcome. So Dr. David, are you available right now? Can I get a quick signal if he is available? All right, so I guess he's not available yet. When he comes on, if there's a chance, he might still be able to, give us a quick keynote speech. However, I would like to move on to introducing our panelists. We don't have a lot of time, but we would really want to have, dive deep into this conversation. And so we want to, be able to maximize the time that we have. So our panelists today, they are seasoned public health experts with huge experience in the area of integrating renewable energy solutions for primary health care. So I'm going to introduce the three panelists that we have today, and in no particular order. And so I'm going to kindly request that as I read your profile, when I'm done, I will call on you, and you can turn on your video and say hello to the people following us even right now. And so I'm going to start with the Program Manager, Sustainable Energy for All, in the person of Luke Severi. Luke Severi is the Program Manager, Sustainable Energy for All. And as Program Manager, he leads the implementation and strategic direction of the Powering Healthcare Program. And this multi-year program consists of several projects focused on market intelligence, sector coordination, and project management of implementation projects, such as a project providing solar PV and storage solutions to large hospitals in Sierra Leone. Luke also manages partnerships with key sector stakeholders, such as the World Bank, UNICEF, UNDP, and USAID/Power Africa. And prior to joining Sustainable Energy for All in 2019, Luke's work focused on energy access and renewable energy technologies in sub-Saharan Africa, in particular for last-mile communities, humanitarian settings, and social infrastructure. And finally, Luke has also worked for international organizations such as the United Nations Foundation, Save the Children International, during which he led projects that provided renewable energy technologies to more than 300 health facilities across Ghana, Uganda, and Liberia. Ladies and gentlemen, I'd like to introduce to you again Luke Severi. Mr. Luke, can you say hello to our listeners online?
Yes, happy to. Hi, everyone. My name is Luke. It's a pleasure to be here, and I look forward to spending this next hour with all of you.
Thank you so much, Luke. Thank you so much. All right, so our next panelist is none other than the country manager, We Care Solar. We Care Solar, and in person of Dr. Julie Yemi Jonathan. Dr. Julie Yemi Jonathan is the Nigeria Country Programs Manager with We Care Solar. She is a physician with robust experience in public health program design, planning, implementation, monitoring, and evaluation. She's a strong healthcare service professional with over a decade of experience in the public health sector. She has managed, coordinated, and implemented projects funded by the Global Fund, USAID, and UNITAID through southern and the northern parts of Nigeria. She famously led the installation of the award-winning solar electric system for over 230 primary healthcare facilities in Kebbi State and trained over 600 healthcare workers in the use and maintenance of the solar suitcase. Dr. Julie is passionate about maternal and child health, and she is committed to improving health outcomes across Nigeria and the African continent. Ladies and gentlemen, it gives me a pleasure to introduce Dr. Julie Yemi Jonathan to you. Hello, Dr. Julie.
Hi, thanks, TJ. Hi, everyone. I'm truly excited to be here and I look forward to a robust conversation. Thank you.
All right, thank you very much, Dr. Julie. All right, the last but not the least panelist that we have, he is the senior renewable energy expert for off-grid team, Deloitte Power Africa. Is the off-grid team lead for Deloitte Power Africa, and he's none other than Tinian Ogieho. Mr. Tinian Ogieho is a senior off-grid energy expert with more than 16 years of experience working across USAID, EU, and the UK aid development programs. He has provided technical advisory support and worked with climate innovation technology solutions, off-grid solutions, renewable energy transactions, and net zero strategies. Mr. Ogieho has worked on energy projects supporting governments and donors across Nigeria, and he has delivered energy sector technical assistance, including his current role on the USAID Power Africa Nigeria Power Sector Program, where he is the off-grid outcome lead. Ladies and gentlemen, I present to you Mr. Tinian. Hello, sir.
Thanks, TJ. Really good to be here and really good to speak with everyone.
All right, thank you very much. So we have Luke Severi, we have Dr. Julie, and we have Tinian. And from their profile, you can tell that these people, they know their onions. And we're excited to have them on Insight Webinar. And, looking forward to the conversations in the next few minutes. If you are watching right now, as the conversation gets deeper and much more insightful, you can please put your questions in the question box and they will take them towards the end of this conversation. Right about now, we will be going on a short break, and while on the short break, we will be sharing a very short video clip for us to look at, and after which we'll come back and dive straight into this conversation. Thank you very much, and then don't touch that online dial.
So far, Nigeria has built about 30,000 primary health centers, or PHCs, across the country, and yet the government is lagging seriously behind in the delivery of quality health services. In 2018, the World Health Organization ranked Nigeria's healthcare system at 187th out of 190, with conflict-ridden countries like Afghanistan, Somalia outperforming Nigeria on the index. The deplorable state of the PHC system has taken a toll on the public health situation in Nigeria. A recent report showed that 1 in 13 women in Nigeria is likely to die during childbirth. The same report found out that about 58,000 women had died from childbirth complications in 2015 alone, accounting for about 19% global maternal deaths in the same year. One can point to different reasons for the dire situation of PHCs in Nigeria, ranging from fragmented services to lack of qualified medical personnel to poor infrastructures. However, amidst all this, a fundamental issue facing PHCs is the lack of access to reliable electricity. Electricity is very important to PHCs for providing water supply, temperature control for medicine or vaccine storage, basic lighting, ventilation, and clinical processes. However, Nigeria's erratic power supply has been the bane of primary health centers in Nigeria. In 2018, the Heinrich Böll Foundation sponsored a situation analysis study that was carried out among 60 PHCs in Abuja, Nigeria. The study found out that almost half of the surveyed PHCs could not operate beyond 5 p.m. due to unreliable access to constant electricity, meaning that they could not accept overnight admission and they certainly could not handle emergency cases at night. Meanwhile, the other half of the surveyed PHCs that could operate into the night often had to rely on alternative power source from petrol power generators and other makeshift energy from kerosene lamps, candles, and torchlight. One of the field monitors during the study reported meeting a midwife who had delivered a baby in the dark because the battery to the torchlight went dead in the middle of the delivery. The lack of electricity is coming at a high cost to PHC's operation and is also a major barrier to quality health services.
All right. Thank you very much for that short video clip. You know, just something I heard now that just, you know, caught my attention and really baffled me is, you know, it's bad enough that a midwife has to carry out delivery with a torchlight. It gets even, you know, crazy that the torchlight now runs out of, you know, battery, because, you know, it's not probably charged well enough. It goes to show you the situation or how bad, you know, it is for healthcare facilities in rural areas. Now, having, you know, watched that, you know, little clip, we are going into the questions for the day. And so I'm going to, you know, ask all our panelists this one question, and I'm going to call on you to just give a quick, brief response. Can you share your experience implementing renewable energy for primary healthcare facilities? You know, I think this is just, you know, us asking you to, you know, share with us what your CV is, you know, apart from us reading it earlier, but having you really share what your personal experience has been. So I would ask Tinian to go first. Tinian, can you please share with us your experience implementing renewable energy for primary healthcare facilities?
Okay, thank you, TJ. So really appreciate this. So I would center my experiences around COVID. Pre-COVID, I worked with FCDO and EU-funded Solar Nigeria program to deliver solar PV solutions ranging from about 5 kilowatts all the way to about 150, 180 kilowatt systems. So not just for primary healthcare only, but up to tertiary healthcare institutions, and to about 100 of these healthcare centers across 5 states in Nigeria. It was a very interesting project, loads of learnings, loads of things we learned along the way. Ensure we're applying our learnings as we're rolling out the project from various funders, from FCDO to the EU. Varied solutions were deployed, like I said. So we had solutions as low as 5 kilowatts and all the way to 180 kilowatts. We had different types of technologies also deployed along the way. So many lessons learned, even from just the series of projects under that belt. However, during COVID, I worked to assist the Federal Ministry of Power in its design for small standalone solar PV systems to 200 PHCs across the country. These were PV systems that range from 3 kilowatts to about 15 kilowatts max. However, post-COVID and under my present role, I manage the off-grid component of the Power Africa Nigeria Power Sector Program, where one of our work streams, we focus on supporting the sustainability of solar PV that's already deployed to public health facilities. So we designed a sustainability plan on behalf of the Rural Electrification Agency that is now helping the REA identify funding sources that can keep the operation and maintenance of these facilities going. How can we keep the lights on? And this is to cover 100 isolation and treatment centers, because this was also part of the COVID-19 and beyond initiative of the REA. So those have been my experiences in the healthcare sector alone. Over.
All right. Thank you very much, Tinyoni. I mean, I'm really hoping that we can, glean from your wealth of experience, and I'm also quite excited to hear, about the push for sustainability for some of these initiatives. That's great to learn about. All right. So I'll go to Dr. Julie. Mark, could you please, share some of your own experience implementing renewable energy for primary healthcare facilities?
All right. My experience has been quite rewarding. I'm sure that from the profile that you read, I'm quite passionate about maternal and child health. So I'm looking at the different levels of implementation. I'll probably start with the beneficiaries because they are the ones at the receiving end. And it's interesting to see that the experience, just seeing the women's faces light up at the PHC, which is at the very first point of call for the women, it's very, very elating for me, and it makes me go to bed well at night, So yes, so the pregnant women, the patient relatives, and even the healthcare workers, you could see that everyone is motivated to come to work. Everyone is motivated to do their part, because of the presence of reliable or renewable energy in the facility. And then, of course, at the state level, you would see that the indices, the health indices are improving. Maternal mortality and morbidity numbers are reduced. Neonatal mortality numbers are also reduced. And then you see survival rates are increasing. Health-seeking behavior of people within the community, within the state are also improving. And then there's also an inverse effect on the financial outcomes too. So these are just my experiences. And even at the state level and even at the national level, everyone is happy that this technology is within the first level of care, not just in the secondary or the tertiary, but you still find it at the very first level. So my experience has been really quite exciting, and it's something that just wakes me up in the morning and makes me put in the very best that I can put in, as long as we have funding and as long as the solar cases are valuable. Yeah, thanks.
Yes, thank you so much, Dr. Julie, for sharing that. I can almost, touch your passion and excitement, and I think it's, very worthy, to see the amount of impact that this has on the lives of, women and children. It's great, and I'm hoping that this conversation can also, inspire the people listening. Maybe we have, people who are gatekeepers, founders, and all of that, to take much more decisions in favor of renewable energy for primary healthcare facilities. So thank you very much. All right, over to you, Luke. Could you please share with us what your experience has been, executing renewable energy projects for PHCs?
Yeah, definitely. When I started working on this topic, I still had a full set of hair. So that's how long I've been working on this. It's been a decade, if not a little bit more. And
Wow.
and I've just seen massive massive increase in momentum. Like we're doing things so much better than before at a scale that like even 5 years ago, pre-pandemic, we could never even think of, right? Talking about electrifying thousands of clinics at a time. So yeah, I've directly led projects in Uganda, in Ghana, in Liberia, especially focusing on off-grid health facilities, public primary healthcare facilities. So the small like, first year of healthcare, where you get the first real level of life-saving health services that the majority of the populations depend on, and where electricity can have just such a massive impact. And where sadly, like, typically it's seen as like, no, we just don't have power. Like we find workarounds, but it's never really pushed. Like we need to have power. We need to have power. So I'm very proud. I'm very grateful that I've been able to work on this for a decade already, and that I've been able to witness the massive progress that and the potentially quite positive situation that we're in today, where we may actually see some light at the end of the tunnel. And that's, you know, we have a very strong powering healthcare program at Sustainable Energy for All, which includes both country level activities, which I'll touch on in a second, but also some global activities, because we can't forget the importance of advocacy, of global coordination, of having reliable data, because if we make decisions based on bad data, we make bad decisions, right? So to give you one example, like if in Nigeria for the PHCs, if we don't know which PHCs have what, if we don't know where they are, if REA has a different data set than NPHCDA, then we have an issue, right? Like then we're going to end up making bad decisions, or we're going to end up duplicating a lot of what has already been carried out. So I'm very grateful that I also have the opportunity to work on these global, like building these global foundations for the health facility electrification sector, whether it's on data, whether it's on sustainable delivery models, whether it's on piloting innovations. And then of course, also always grounding that in country level work, where I'll just touch on one project that is currently, we're kind of in the middle of it, where we're electrifying several hospitals, like large hospitals and smaller health facilities in Sierra Leone. The first 6 came online exactly a month ago. The next ones will all come online in the next 4 or 5 months. So yeah, we have a wide portfolio, a big work plan, and we're keen to work with everyone out there. So I think that's also an open invitation to accept any questions that you may have. Back to you.
All right. Thank you very much, Luke. And thank you, everyone, for sharing from your wealth of experience. I think that you can all be proud of the work that you have done so far. And I think it's also important for us to have conversations like this so that the larger public can be aware of the need to advocate for increased investment, in renewable energy and the impact of, renewable energy, the positives, of this for primary healthcare facilities across, the world. All right, so we're jumping into the next question, which is for Dr. Julie. All right, so Dr. Julie, considering your experience working with, primary healthcare facilities and your investment in maternal and child health care, what are the major considerations when it comes to integrating renewable energy in primary health care? In your own, experience, what are the major considerations?
Yeah, okay, so there are very careful considerations that we put in place in ensuring that renewable energy is integrated into the PHC. And some of the things that we consider are the energy needs. We want to be able to know what are the electrification rates for that facility. Is the facility connected to the national grid or not? Do they have regular power? How many hours of power do they have in 24 hours? And then we also want to see the functional needs. The functional needs being that, is it functioning? Do they have human resource? What are the services that they provide? Are the services basic, the minimum basic standard, or do they just perform only outpatient services? You also want to see the structural needs. Are they in a permanent structure, or they're in a temporary structure? Are they also, do they have enough space to, because you have to consider that once you bring in renewable energy, you are very certain that services are going to improve, number of clients is going to improve. So do they have the structure to be able to accommodate an increase And then the very next is you also want to look at the human resource ratio. Do they have the human resource? Do they have skilled birth attendants? Do they have skilled professionals, healthcare workers, midwives? Do they have nurses or doctors to provide the adequate services that is adequate for that particular facility? And of course, the context here is the PHC. A lot of our PHC, some of our PHC don't have doctors. So do they at least have a midwife, a nurse, a community health extension worker? Do they have the basic requirement, nurses, lab technicians, pharmacy technicians? You know, you just want to be able to know some of all those things. And then, of course, you want to see the capacity building. It's not enough that they now have all this. Do they have the skill set to be able to use and maintain the renewable energy that you're bringing to the facility? And then you also want to check about the cost considerations. Are they able to fund it? And if they are not able to fund it, if you're giving to them at no cost, are they able to maintain it? Is there security in place to be able to protect it? You know, so these are just a number of things that we consider, that you should consider before integrating renewable energy into the PHC.
All right. Thank you very much, Dr. Julie, for that robust response. And I was just trying to take a few notes from what you were sharing. So you listed a few things. Energy needs, functional needs, structural needs, human resources, and also looking at what the existing capacity is. All right. Thank you very much, Dr. Julie. This question is for Tinian. So what do you think is impeding the effective transitioning to sustainable renewable energy in primary healthcare facilities? What do you think is the challenge? Why is it that we have not been able to effectively transition yet?
So interesting question. So it's all based on it's primarily based on financing and maybe on the sustainability of even previously deployed systems. And if you want to look at the financing situation of these health facilities, you have to also look at the ownership of the facilities themselves. So for federal or state-owned facilities, funds trickle down to these facilities even for basic maintenance. There's supposed to be like the Basic Healthcare Provision Fund that is meant to support primary health centers, for instance. However, those funds are not even enough to power a generator past a week, just as an example. If you let's flip this a bit. Let's look at private healthcare facilities, for instance. Private healthcare is looked at as a viable business case in terms of attracting financing, because you have compact management that can quickly take decisions. You can easily, financiers can easily look into private sector, private healthcare facilities and identify their energy sources that they use presently. For example, those who use petrol or diesel generators, you can easily make the switch from the funds that are used for diesel or petrol and switch that into like paying in installments for alternative energy sources. So it's easy to make a business case when you see the books are easy to look at, you can quickly make those decisions and things like that. So that's why you have private healthcare having a better business case and adopting that change. However, in the case of public healthcare facilities, it's quite different. It's really not viewed as a viable business case to attract much needed financing, and for a number of reasons. Like I mentioned earlier, the poor financing from the ownership, from the financier, there's really limited, from the financier's point of view, if they look at it from a risk angle, there's really limited collateral to back the financing. There's not much credit enhancement you can also throw in there to support project developers that want to look into public primary healthcare situations. So all those different things actually affect the adoption of clean or alternative energy sources for public primary healthcare. Another thing that is worth mentioning, and this particularly might be in the Nigerian context, the macroeconomy is not also helping matters. We have a time where we are faced with a weakened currency. CapEx is now more expensive. A lot of what you need to make this switch is imported. So you have a situation where even to attract foreign investment to support this kind of financing is a huge limitation. So these are the different ways. And then lastly, I also mentioned that if you look at the trend of how previously deployed systems have been managed, it doesn't now create, the opportunity to, it doesn't encourage financiers to continue to go financing public primary healthcare facilities. So you see situations where donors or the government have deployed clean energy systems in the past, and little to no maintenance is being provided, and then these systems, they get dilapidated over time and run down. So the financier looks at all that and what's the mechanism to support the operations and maintenance? Why should I put money into this? What are the returns that can come off this? So it's quite challenging, I must say.
All right. Thank you, Tinian. I think what you said is, nothing but the truth, and it's a huge challenge. I'm hoping that for people watching and listening to this conversation, we might have 1, 2, 3, or 4 people who can begin to think in the direction of possible solutions to some of these challenges. All right. So I'm throwing the next question to Luke. And this is the question for you, Luke. Are there case studies or global best practices that highlights the impact of renewable energy in primary healthcare facilities? You want to share a few, 1 or 2?
So I guess the answer is yes and no. So there are definitely projects out there that are making good progress when it comes to best practices. When you think about this, especially from a technical perspective, big solutions, remote monitoring, hardware and software, like systems that are really, really top notch. I think those are probably the easiest ones to find. I think increasingly we see an increase in the quality of the work that's being done. There's better clarity around minimum quality standards for the components, minimum quality standards for the installations. Then when it comes to sustainability models, I'd say we're more at the pilot project stage. When it comes to extreme long-term sustainable models, and with extreme I mean energy as a service in a 10, 15-year horizon, which the majority of large-scale projects implemented by your typical development partners, UNDP, World Bank, USAID, etc., typically cannot get to 10, 15 years. And I asked the question whether they have to. We can put that to the side. But there's progress there. But that to me is the area where we need to see the biggest leap still, is how can we get to a place where projects are designed with a decade-long horizon, with already integrating and identifying how we could replace the batteries when they ultimately phase out in year 7, 8, 9, or 10. Same with other key components, and that we know who's gonna replace them and how it's gonna happen and how it's gonna get funded. Now, that to me is and again, it's the long-term sustainability. It's the big question. The pilots that are happening, I think they're very exciting. I hope that everyone who's organizing a pilot can actually share what they're doing, and maybe more importantly, can share what is not working, because we learn much more from that. Because this is my sense is a lot of these pilots may work in specific conditions, and whatever works even in one state of Nigeria may not work in another state, and we need to acknowledge the contextual factors that mean that in some areas, some types of models may be more prevalent or maybe more appropriate compared to others, right? And to touch on the last thing I want to say is to touch on your point on impact. Impact is a tricky one, right? We know instinctively that you want power in your clinic, but it is oftentimes very hard to prove with hard data that X number of electrons saved X many lives. And again, I question whether we have to go that far. There's a range of case studies that try to come up with proxies, say, talk about, like, we installed reliable power, and then we do pre and post surveys around patient satisfaction, around staff satisfaction, around vaccination rates. And from there, you try to use them as proxies to essentially, like, show that indeed there is impact. But the reality is, power is necessary, but not sufficient. Your electrons are not going to save lives. Your electrons go to the appliances. Your appliances are used by health workers, and then health workers use them to give health services to patients. Like, if any of those elements are not in place, then you're nowhere with your power, right? Like, I think we always want to acknowledge that. I think we never want to argue that power needs to be the only thing that we need to invest in. It always has to be an and story. And that's maybe, again, going on a slight tangent away from your question, the element that I feel we're still missing in our sector is the appliance side. It is one thing to put solar panels on the roof of a clinic. That's actually not that complicated. Keeping it running is complicated, but making sure that it's used appropriately is actually also quite complicated. Because typically the solar PV, like the solar energy provision, sits in the energy sector, and the medical appliance provision sits in the medical sector. And it follows a very different procurement supply chain. There's different compliances, different quality standards that you need to adhere to. And I wouldn't want to ask an energy company to procure an autoclave, right? Because they don't know where to go, they don't know what to get, they don't know what is minimum quality standards, et cetera, et cetera. So I think that to me is still like, it's a missing link that is actually quite a critical one to ensure that if and when power is available, that it's actually also used in the most efficient way and in the most appropriate way. Because going from A to B doesn't always happen automatically, or there's quite a long lag time between having reliable power than actually having all the appliances that you should be having at that level of healthcare. Over.
All right. Thank you very much, Luke, for that perspective. Bringing perspective to the situation on ground, and like you've rightly said, actually, it's not there is no silver bullet that solves everything at once. There's a need for interoperability between the industries, for the medical sector, for the energy producers, and even for the people that get to use this things, the human resource. So there is a need for that perfect blend, collaboration that enables this initiative to be maximized. Okay, so when Dr. Julie was speaking earlier about considerations when it comes to integrating renewable energy, you had mentioned considering capacity, as capacity as a major consideration. So right now, I want to ask you, Dr. Julie, what is the level of technical capacity that is required to effectively integrate renewable energy for primary healthcare? What is the level of technical capacity required?
All right. Thank you very much. It's really been an interesting conversation. Look, there's a lot I have taken note of from what you have said. So yes, the capacity depends on the technology, or depends on the solar system or the renewable energy that is at the facility level. So we know that there are different types, different grids, different levels. There are more complicated ones and more easy to depends on the level. But I will speak probably of my own experience to say that making the solar system as easy to use as much as possible makes it easier. So you don't need so much skilled professionals, or you don't need so much technicality for you to be able to use and maintain the solar system. Another thing you also need to consider is the assessment of the solar system, how accessible it is, who has access to it. This is also something that you also need to consider, because you need to be able to prioritize the capacity of the people that should have access to the solar suitcase. And then, having that little cohort, the smaller the cohort of people that have access to the solar system, the better for you. So that even if you have to train them on how to use it or how to troubleshoot it or how to, just maintain it, it will be easier for you. Another thing you also need to know is maybe I think I talked about the system design and the engineering. Another thing to note is also the monitoring and evaluation, because the capacity of the people that need to be able to monitor its use and monitor its ability to be able to know the impact of it also matters. And you really don't need so much high technology skills. Maybe to install it, yes, at a point you need the adequate engineers or technicians to provide that installation. But after the installation, the use and the maintenance and the monitoring and the troubleshooting or even remote monitoring, you may not need so much skill set to be able to do that. And I think that the health sector has been able to create technicians, knowing that Gavi in our freezers, immunization freezers, they've been in the system as long as some of us can remember. So they already have that cohort of trained technicians that provide some level of maintenance. So being able to carry this already existing team along and training them on the use and the maintenance and have routine maintenance of the solar systems is also something that would also help. So yes, we don't need so much technical know-how, but it all depends on the solar system and the design and the technology that they are actually supporting the facility with. So, yeah.
All right. Thank you, Dr. Julie, for that response. I'd like to let you know if you're joining us. Dr. Tian, you want to say something?
I wanted to just chip in on both points Dr. Julie and Luke had mentioned. And this is to buttress the importance of sustainability, both from the technical capacity and right down to community ownership. Since we're talking about public primary healthcare centers in particular, one of the things we've realized is that, like Luke said, the easy part is really the electrification of the systems. I'm sure Dr. Julie will also agree to that. However, keeping the lights on is the huge, huge challenge. And that's where a lot of lessons learned now come in. So you need to factor in a lot of your time into community ownership of these solutions that will be provided. There needs to be a lot of engagement. There's a general mentality, especially when these systems, these solar PV solutions are maybe donor funded or government funded, where there is the mentality of it's part of our national cake, it's our birthright, or it's a free facility. So you need to improve and educate and improve the willingness to pay for these systems. They have to understand that sustainability of these systems come with actually paying for the solutions. So that now increases how they would use the systems. Naturally, I think Dr. Julie had mentioned this earlier, where when solar PV is deployed, you see different energy solutions now coming into those medical facilities, either by way of donations or, people just start to support that particular facility. So once that happens, how can you use those electronic medical equipment to generate much needed revenue that can cover basic things like someone to clean the panels, someone to secure the systems, I have a security man, someone to check battery levels from time to time, So sustainability is key, but you can't do this without involving the local community. And then to Dr. Julie's last point on the technical know-how, you also have to get local technical expertise to sustain the systems. Over.
All right. Thank you, Tian, for that wonderful addition. Just before I ask the next question. Please, if you have questions, put them in the question box. And I'd like to get a commitment from our panelists that in case we're unable to take all the questions, you will still, do us the honors of responding to all these questions, and then we can put them on our social media platforms for people to, get answers. All right, so I'm going to just go to Tinian, and this time around, I'd like us to be able to run through, a few more questions, and that will mean, us being able to, manage time with our responses. So for you, Tinian, when you spoke earlier, you talked about, financing. So I want to ask, we know financing has been a major challenge, for primary healthcare facilities and renewable energy. What are the alternative fundraising mechanisms to support renewable energy integration? From your own experience, what are alternative fundraising mechanisms?
Okay, so traditional fundraising methods, like I said, have either been government, either providing for these systems, or you have donors or implementing organizations just supporting. However, we're beginning to see new trends in like using CSR type anchor model solutions, so companies that have interest in local communities, now either in communities that have existing mini grids or where they can actually deploy captive power, they are now extending electrification to primary health centers by way of CSR to support those communities. One common example is where you have telco sites. So a telecom tower provider or infrastructure provider, naturally would have electricity to power its tower, and then they now extend electrification to a PHC. Others which have been done in the past can also be a consolidation of donor funds and matching them with counterpart government funds. So donor funds can come in to help with, CapEx, and then counterpart government funds can also help with the OpEx of delivering these systems. Then in recent times, we've had a number of transactions where we've supported the use of local finance guarantees, especially for the energy as a service model. You now have a situation where a local guarantee provider provides the financing required to fund the CapEx, and then the developer now produces the required energy as a service to the primary health center. And then, of course, with the influx of carbon credits, distributed renewable energy certificates, as far as there are credible audit processes in place and verification mechanisms are in place where you can show a switch from diesel or petrol generator to clean energy sources, you can introduce these DRECs, as we call it, or carbon credits as future alternate means to finance these primary health centers. Over.
All right, thank you so much, Tinian. So quick, just riding on the back of Tinian's response, Dr. Julie, what do you think are the gaps when it comes to the regulatory framework that supports, integration of this nature?
All right, I don't know if we have. So this question, and I think that we need to be very careful, because the gaps a lot of times is stemming from is an end-to-end approach, basically. Government with their policies, we don't have proactive measures by government. There are no operative procedures to regulate quality of equipment that come into the country. There are also no exemptions or incentives for people that want to support with renewable energy. There are also no flexibility of imports of renewable energy equipment. And of course, internally, we don't see the political will of politicians, and politicians at different levels, basically, because I think I heard Tinian talked about the community. And that's one thing we try to do whenever we want to install a solar system in a facility. We ensure that the World Development Committee is on ground so that they take that level of ownership at that grassroots or at that facility level. They take that ownership, they make commitments to protecting against theft, against insecurity, damage, or any form of, damage to the system, So there's that political will. And then also for sustainability, we don't see in our annual operational plans at the state level, in our even release of funds for operations and maintenance of the solar systems that are already in the facility. So these are a number of gaps that we see that really mitigate and just try to make renewable energy in the PHC a bit difficult. Yeah.
All right, thank you very much, Dr. Julie. So quickly, I'm just going to throw this question to Luke. Please keep your questions coming in. We'll provide answers to them all. All right, so Luke, Dr. Julie has spoken about quite a number of gaps when it comes to the regulatory framework that supports integration of renewable energy in PHCs. So from your own experience and expertise, what policy measures can governments implement to incentivize the integration of renewable energy solutions in primary healthcare facilities?
I always start with data, because I feel like that's where if we don't, I mentioned before, if we don't have the right data, then we just end up making bad decisions, or we're not able to make decisions. So I would really encourage government agencies to first and foremost work together across the energy and the health sectors and come up with some kind of a consolidated dynamic database that captures every single health facility, what has been deployed, when was it deployed, what kind of O&M, like operating and maintenance regime, is it under? Because that will allow a government to, at least at a glance, whether it's REA, whether it's MPHCDA, whether it's the Ministry of Health, it will allow them to at a glance see, this is how many facilities we have. These are how many facilities are off-grid. These are how many facilities have no power. These are the ones powered primarily by a genset. And if the next new project comes in and says, hey, I want to know where all the clinics are and I want to power 100 clinics, tell me which ones to electrify. Typically, that answer will take months to get. And that's with some kind of like a dynamic database, it actually gets you there potentially in 5 minutes in terms of like which are the 100 or 200 or 500 clinics to prioritize furthest from the grid with the least amount of power with a big catchment population. Those are like a few criteria that are actually very easy to capture, but you need to have consensus around what is this database, who manages this, how do we keep it up to date? And then if I can highlight just a second one, a second kind of like an element in the policy space, quality standards. I really do I would love to see governments focus on quality standards, making sure that whatever is deployed in health facilities, that it meets a certain criteria. Like that it meets the needs of the health facility, that the quality of the components that is brought in is appropriate, that it's in line with international standards, that the way installations are done as well, that it's good, because the reality is like the majority of systems, of solar PV systems, fail prematurely. And that's not because solar doesn't work, even though that's often the reputation that it gets. It's purely because there's no maintenance happening. The components that were chosen that are not appropriate. The installation was not done according to standard. And those are, for me, like two big investments that a government can make that I think over time will actually have a very big influence over how the sector is managed. Over.
All right. Thank you, Luke, for that insightful position. So quickly, I would like you to just answer this question, as briefly as you can. What role can public-private partnership play in supporting renewable energy integration for PHCs? What role can public-private partnerships play?
Sorry, it's silent. Was that question for me? I'm happy to go first. I think it's critical, right? Like, it's critical because we know that the public sector alone is going to struggle to close the energy gap in 30,000 PHCs in Nigeria, in 100,000 health facilities in sub-Saharan Africa, right? The public sector is not able to do that, especially the health sector, which was already critically underfunded. The private sector alone is also not going to be able to do that, or is not going to be willing to do that, because the risks are too high. As Tanya mentioned, like ability to pay, willingness to pay, all the risks, energy as a service over 10 years. 10 years is 2 presidential elections. It's, you know, it's a very risky setting to do to sign these types of long-term contracts. So I do think public-private partnerships where public funding and grant capital still have a very, very important role to de-risk appropriately, to then unlock the type of private capital that can really get us to scale, are critical. Much easier said than done, of course. And that's my last point that I really just wanted to squeeze in today is I do feel like often we are overcomplicating things. We are talking about these massive energy as a service and beyond models with special purpose vehicles and fund managers and all that. And it almost feels like we want a rural Nigerian PHC to be more financially sustainable than a small clinic in the US or in the UK or in Europe. And that is a situation that I think is kind of unacceptable, right? I think we need to acknowledge the reality. I think we always need to acknowledge that health, especially primary health, is a human right. So we need to make investments. We need to find the right type of funding and financing, both to get there. Over.
All right. Thank you so much, Luke, for drawing our attention to that. Okay, so finally, I mean, this conversation is so insightful. I wish, we had much more time to answer more questions, because it looks like we have an inflow of questions from the audience. But like I said, we're going to send these questions to our panelists, and they're going to provide answers, and then, we can share it with, everyone. So quickly, for final remarks, Tinian, where do we go from here, to just round it up, given everything that has been said today? Where do we go from here?
So, like Luke mentioned just now, healthcare electrification. Healthcare is a basic need. Electrification is a part to improve healthcare delivery. It's a joint effort by everybody. We have to continue to make that business case viable, improve the willingness to pay for this service that is provided through electrification, and let's just continue to build it from there. There is no perfect situation. However, we need to support electrification because our focus should be on improving health outcomes always. So let's do the little we can every step as we go, and we'll see how it turns out. Over.
Oh, thank you very much. Like you said, our focus should be on improving health outcomes. I find that, in the course of the conversation, everybody sharing their points, we're able to provide some answers to questions that are, some questions that are in the chat box. However, I think I'd like to just maybe, take just one question, so that we don't just run without answering any question. Okay, so I'll take this question from Ahmed Shehu Tinta. He said, what are the technical differences between on-grid and off-grid renewable energy systems? With a focus on their integration into remote primary healthcare facilities. So can anyone take a start of that? The differences, technical differences?
Yeah, I'm happy to just give a perspective. So I think both are important, right? Like when we talk about on-grid facilities, typically, like I say, district capitals tend to be better electrified. Talk about larger types of health facilities, hospitals even. The issue is not about providing energy access, because they already are connected to sometimes a weak grid and a reliable grid. They have gensets as well. So it's more about energy security, energy reliability. And then, of course, in one go, especially when diesel generator reliance is high, which tends to be the case in Nigeria, you have a much stronger environmental argument, right? Like that for us is the way to bring in climate finance, to bring in climate actors, to say we are displacing diesel generators. What you won't necessarily see at that level is a massive increase in, say, new health services taking place once you provide reliable power, because these are hospitals that are, of course, already operational. They know what to do. They find ways to offer the services that they can do. It's more about reliability and environment. In the off-grid space, you do talk much more about the health impact, because, like as I mentioned, I like to exaggerate. If a facility has one light bulb, And suddenly you come on with a big power solution, and they can run a microscope, and they can run the autoclave and have running water and have power in the staff quarters. You are going to see a bigger increase in terms of the number of people that go to the facility, the health services that can be offered. So I'd say both are important. They're not the same. Like large on-grid is much more about reliability and environmental impact. Small scale off-grid rural facilities is much more about first-time access and really impacting the health services that need to be offered.
All right. Thank you, Luke. Tinyan, do you have anything to?
Yeah. So very quick example. Ekpe, Lagos State. There's a primary health center. 2014, it was completely off-grid. There's a Ekpe General Hospital. It was on-grid. 88 kilowatt solar PV was installed at the Ekpe PHC. Constant electricity came into the PHC. General Hospital moved its cold storage unit to the PHC. That's all. Case closed.
Awesome. All right. So to just round this up, I'm just going to throw this to Dr. Julie. Someone asked this, and the person was asking about being able to get communities to take ownership of existing renewable energy solutions in facilities. So what do you think about, how can we get communities to take ownership,
All right. We're already on the clock, but just to quickly say that the World Development Committees, they are part of a health, like a health committee within the community. They are part of that health committee. They know what is going on within the facility. They understand what is required, what is missing, and what needs to maybe repair or maintain. So having them on board, whatever it is that, especially for renewable energy that you're bringing to the facility, it makes it easier for them to own it. And then the BHCF funds that the Federal Ministry of Health, also supports the primary healthcare with, also helps for ownership and sustainability, because of course that funds, they do like a decapitation that is sent to the facility, and they use it well. They do like revolving funds. They're able to know what to use that money for. And the World Development Committees are also part of the BHCM fund. They also make decisions in what the money should be used for, the prioritization of that funds, and how the funds can also be used. So yes, in that case, the community actually has a stake. They are shareholders in the renewable energy in the facility, and they make the decisions and also provide some sustainability to it, knowing the benefits of the renewable energy in the facility.
All right. So thank you very much, Dr. Julie. Thank you, Tinyan, and thank you, Luke, for sharing your wealth of experience with us, lessons that you've learned, and possible solutions for the future. Thank you very much, for making this conversation truly insightful. And I want to say thank you also to everyone who has tuned in to be a part of this webinar. Please do not forget to follow us on our social media handle for more insightful information. I would like to appreciate each and every one of you for staying from the beginning or from wherever you joined us up to this moment where we're bringing this to a close. So I want to say bye, everyone, and see you at the next webinar.